Hello, and welcome to this Healthcare Compliance Solutions Program tutorial. My name is Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions. And here's my contact information if after presenting these compliance solutions, if you have any questions. Now, we provide solutions for HIPAA, OSHA, Medicare, and HR. And so that will be the discussion today. And we provide these solutions for practices all over the country. So my guess is just down the street, we have customers. And so really this is a presentation to introduce you to what your neighbor's doing. Now, what I'd like you to feel comfortable doing is after I go through and ask a few qualifying questions, I want you to make a decision on whether or not it still makes sense to move forward. Now, my guess is, because it's likely that this was sent to you, that you are moving forward in understanding these solutions. So then after I present our solution, I'm going to ask you to make a decision. Okay, compliance isn't typically the highest thing on the priority list for a lot of healthcare organizations. Typically, the reason that you're looking at a company like ours is because, well, you're going to be audited, or you have been audited, or you've been fined. You're dealing with a disgruntled ex-employee who's complaining about how things were done with HIPAA violations or with something related to patient records, and so you're wanting to make sure things are good there. Or maybe you've gone to the wall of shame and noticed that there are several people in your state that have been fined, that have been audited. It really is so much more common. And if you want to know where to find that wall of shame, you can just type in wall of shame and HIPAA and find out who's in your neighborhood, who's recently been audited. Well, what to expect? I'm going to go through some qualifying questions and then get into 7 fundamental elements of an effective compliance program. And this will come straight from HHS, the Health and Human Services Organization. We'll get into what to expect with HCSI, and we'll move pretty quickly, get into pricing, and then I'm going to show you how to set up the online portal. So some qualifying questions. Again, this should be asked for HIPAA independently, OSHA independently, Medicare and HR, all that are applicable for your office. So be thinking about these things. Have you trained your organization this year? Do you have updated compliance plans? Do you have customizable compliance forms? Do you have a risk assessment for HIPAA, for OSHA, for Medicare? And do you have a compliance expert? Now, if you have multiple offices, this question would be, do you have a compliance expert in each office in a culture of compliance? Here are the 7 fundamental elements of an effective compliance program. Again, this comes straight from HHS. The first being implementing written policies and procedures and standards of conduct. The second, designating a compliance officer and compliance committee. The third, conducting effective training and ongoing education. The fourth, develop effective lines of communication. 5, conducting internal monitoring and auditing. 6, enforcing standards through well-publicized disciplinary guidelines. 7, responding promptly to detected offenses and undertaking corrective action. Sounds like quite a bit of work, right? Especially when you consider that we only have 168 hours in a week. And if the person that's presenting this to you is saying, hey, are you serious? You want me to do this? Okay, it's crazy to think that one person, especially in larger organizations, can do all of this. I mean, they're focusing on patients, staff, ensuring front desk operations are taking place. They may dip their hands in accounting, and close to the very edge is fun, and we always make time for that. It seems like before compliance, right? So there should be some solutions, some done for you solutions. Well, that's where healthcare compliance solutions comes in. We like to say we make the pieces fit so you don't have to. And this is with OSHA, if that applies, or HIPAA, or Medicare, or employment law and HR, or all of them. Okay, we really are an all-in-one solution. So if you're at a point now where it makes sense, I must ask you, based on those questions that I asked, do you have a budget aside for this? If so, consider what that budget looks like in round numbers. Okay. Well, let's move forward. So what do you expect with HCSI? Okay, we went through all of those things. Well, in satisfying those demands, we have an online members portal. We have compliance binders, and we have ongoing support. Okay, we like to keep it simple because for some reason the government, well, they don't keep it as simple. Okay, so those three things. Now, within those three things, I'm going to move pretty quickly. You have the training. It's online training, new employee year. You have the manuals, specifically a compliance plans manual. If you're ever audited, you just give the manual to the auditor. And we have customers that are typically amazed that, oh my goodness, it worked. They looked at it, scanned it for a minute, and then walked away. You'll have ongoing compliance support, regular updates, quarterly newsletters. You can call or email us at any time. A quarterly assessment of your program. We actually get into your online portal, see if things have been done in the past 3 months, and then if they haven't, you back to the gravity of, hey, you know what, these things are changing often, and let's talk about the absolutes that need to be incorporated into your practice. We have customizable forms. There are about 100. Okay, we'll help sort through that. Every quarter, we do this implementation support where it really is a health checkup on your policies and procedures, your ongoing documentation, your training, your business associate contracts, your risk analysis and risk management action plan, your security incident and breach management. Okay, you may be quite surprised on how many breaches surface, especially in an organization that is larger. And so it's important that corrective and preventative actions take place. Well, what's the price? Well, it's only $350. $350 per year, and then $3 per employee. Okay, now this is an annual subscription for each location. All right, we support independent locations because they require all of those things we just mentioned. I'm going to back up. Okay, all of this needs to be incorporated into each location. The government wants you to have things practice and location specific. Okay, the forms, the over 100 forms, okay, those are implemented on an ongoing basis. Okay, these newsletters we send out every quarter, and they're to be reviewed with all of the staff at that location, signed and dated. And we do this because, well, we want to make sure you're always aware of the updates, and we just cut through the clutter and provide you what you need. Okay. Now, that said, talk about the next steps, and then I'm actually going to show you the setup process. So the next steps are, hey, if having an online members portal with all the training, with all the forms, with the risk assessments, having the binders done for you with compliance plans and ongoing support sounds good, then let's focus on number one. Let's purchase and move forward. Number two is the setup process. Okay, what do you do from here? Well, it's pretty simple. You get an email with a confirmation for each account. If you're just one office, then you'll just purchase one. You'll get a confirmation that will have login information. From there, you'll go through a setup process, which I'll show you in just a minute. In 48 hours of the purchase, there's an implementation specialist that will contact the administrator of the program, and we'll walk them through setup, which I'm going to go through very quickly right now. And then number 4, you just, on an ongoing basis, call and talk to us, email any questions, and we focus on ensuring that risk is reduced to protect your patients, protect your reputation, and ensure that you're constantly improving on your compliance plans. Okay. Now, from here, I'm going to go to HCSI.com. Okay. And then what you're going to do is you'll click on healthcare providers. After your confirmation email comes to you, there will be a login. There will be login codes. And the office ID I'm going to put in there, and then the employee ID. You can tell I've done this before, right? And then you sign in. Okay, now the nice thing is tabs, but everything will have this disabled pop-up except for setup. Once setup's been completed the first time, you won't have to worry about that again. The only thing you'll do in the setup process is add your staff. Once employees are here and you've designated somebody to be the compliance officer for HIPAA, OSHA, and Medicare, that person will go through. Oh, by the way, you can add and delete employees here. If there's turnover, you simply add the employee. If you want them to be one of your compliance officers, you simply designate them. Compliance officers here will start at the policy section and go through and create a policy manual. If there's a need to create custom policies, well, you can do that with us. If the implementation specialist provides some recommendations, he can help through that. But you create your policy manual. After you've created your policy manual, the government wants you to focus on environmental, facility, and hardware and software risk factors. I'm just going to click on facility. And you'll find there are several risk factors. One of them that's very popular is record snooping. And with record snooping, have any safeguards in your system, in your software program that provides an alert. Well, that's a good thing. But if each employee that you have in your organization if you don't have, it says how much access they're allowed to have for that position, then you may be in the medium category. Okay. So from here, you identify risks. This is, again, facility. So facility, you'll have locked doors. You may have some property controls. You'll click a minimum of five items and then click update. Okay, so they'll go through that really quickly. All the remedies are down here at the bottom, and they do show up to the right of each risk factor. Okay, OSHA. OSHA has a risk assessment, a hazard risk assessment, for example, where you identify instruments, equipment, chemicals, gases, and vapors, and then any additional things that are customized for your office. And with this, let's say you're a physical therapist, and yes, this is a healthcare provider's, we're a healthcare compliance solution for healthcare providers across the United States. So yeah, physical therapy equipment may not be something that you may use, but you may have some of these chemicals or gases and vapors or other things that are applicable. Okay, and all you'll do is just simply select is applicable. Okay, and these risk assessments should be done every year. After it's done one time, it'll be really simple to just go down the list for your compliance officer in that location and see what's applicable. Okay. After that's done, so I'll click on this training tab, and everything will be grayed out except for what you're able to do. So you'll go through general setup, and then after general setup, there is a HIPAA security setup, and then after this HIPAA security setup, the actual training will be available. Now, let me just ask, how comfortable do you currently feel with the person representing compliance in your practice? Do you feel like they have any idea of their role and responsibilities to implement compliance policies and procedures? Well, if your confidence level isn't super high, which I imagine that there's always some improvement wherever you're at, we have management training that your compliance officers will go through for each of these modules. And we do that because we want to ensure that the compliance officer understands the landscape. If you just had a consultant just come in one time, certainly they could do the training, they could implement a bunch of things, but when you think about it, if an auditor comes, they're not going to be asking for the consultant, they're going to ask for the expert at the office, and that individual is going to be somebody that has been communicating all the forms, the roles and responsibilities of others that are implementing this compliance program. Okay, so we want to make sure there's a training that's been put in place for your compliance officer to ensure that they feel confident in their responsibilities. Okay, now I'm just going to click through this. In each of the trainings, there's an area for your staff to click I understand and will follow. Take that to heart and say, okay, you know what? I will do that. I will follow these policies and these procedures that have been created. Okay, and as they move through it, there are several of these for administrators. And I'm going to go back through the employee training because it's a little bit different. For the employee training, in addition to these understands and I will follows, well, we actually do a quiz to make sure that they do understand. Now, if you click the brain and that's not the right answer, then you can click the false button or the garbage can, and it'll say great and progress you through this. Now, when the training's finished, there's a certificate that will go into the employee's file, and then the employee also keeps one for themselves. There's an online reference guide of all the laws. You'll also have a hard copy of that. Here are all the customized forms. And there's about 100, and each of these have a table of contents. And throughout the year, we do administrative alerts. We just did one at the beginning of each month, and these provide any of the updates that the administrator or the compliance officers will need to understand. Okay? So purchasing is very simple. When you're at the Home tab, it's just Pricing, Order, Renew. Click Client Order, click Purchase, and then there will be 2 screens after that that will walk you through adding your basic information such as employees at this location. Now, if you're logged in the future, this is also a way for you to renew with us. That's why the price only shows $3.95 here. Okay, so if you do use a test account and you do go through this process, it's only going to give you that subtotal. But you just put in the address information, the email that the updates will go to. We send regular updates to the email. Then you click Proceed and put the credit card information in. All right, well, that is that is the onboarding process. Now, you may be saying, well, we do have multiple sites. How do we do that? Well, it's pretty simple, actually. You'll just have a corporate compliance administrator, and then you'll have a compliance officer at each location, and that compliance officer is usually the office manager. And that office manager can be the administrator of the program in that office and also the HIPAA, OSHA, and Medicare compliance officer. Or they can delegate it to a nurse. Maybe the nurse will be HIPAA and HR, and maybe a medical assistant will be OSHA and Medicare. Very, very simple. My name is Lance King. I'm the Vice President of Sales here. I'm happy to answer any questions, facilitate them the best that I can. Give us a call at 801-947-0183. Let us know that you saw this presentation. I'm also at lking at HCSI.com. This has been a presentation of our Healthcare Compliance Solutions program. And again, we hope that you'll make a decision and allow us to become your compliance business partner. Thanks.